In this session, we will study ICD-10-CM Chapter 21, titled Factors Influencing Health Status and Contact with Health Services, covering the code range Z00 through Z99. This lesson is for educational purposes only. Please refer to official ICD-10-CM guidelines. Learning objectives. By the end of this lesson, you will be able to explain the purpose and role of Z-codes. Determine when Z-codes can be used as principal or secondary diagnoses. Correctly apply Z-codes related to contact, screening, status, history, and observation. Differentiate between status codes, history codes, aftercare codes, and follow-up codes. Apply Z-codes used in pregnancy care, counseling services, donor encounters, and routine examinations. Identify Z-codes that may only be used as principal diagnoses. Understand the coding rules for social determinants of health, commonly referred to as SDOH. And finally, avoid the most common CPC exam mistakes related to Z-codes. Purpose of Chapter 21. Z-codes are used to explain the reason for healthcare encounters. These codes provide additional information about the patient's condition, background, or circumstances. Examples include situations such as routine health examinations, immunizations, exposure to diseases, or follow-up visits after treatment. It is important to remember that Z-codes are not procedure codes. Whenever a procedure is performed, a corresponding procedure code must also be reported. Use of Z-codes. Z-codes may be used in any healthcare setting, including inpatient, outpatient, and physician office visits. They may be assigned as either principal diagnoses or secondary diagnoses, depending on the circumstances of the encounter. However, some Z-codes are restricted to principal diagnosis use only, which means they must appear as the first listed diagnosis. Coders must always review the official guidelines and coding instructions before assigning these codes. Z-codes as principal diagnosis. Z-codes may be reported as the first listed diagnosis when the encounter is primarily for services such as screening examinations, counseling services, routine health checkups, observation for suspected conditions, aftercare visits, follow-up visits, or administrative purposes such as employment physicals. In these situations, the Z-code explains why the patient came to the healthcare facility. Contact and exposure codes. Category Z20 identifies contact with communicable diseases. Category Z77 identifies exposure to hazardous substances or environmental risks. These codes are commonly used when a patient has been exposed to a disease or hazardous substance but has not developed the illness. Contact or exposure codes may be used as either principal diagnoses or secondary diagnoses, depending on the reason for the encounter. Immunization Code Z23. Code Z23 represents an encounter for immunization. This code indicates that a patient is receiving a vaccination to prevent disease. However, assigning Z23 alone is not sufficient. A procedure code must also be reported to identify the specific vaccine administered. Z23 may also appear as a secondary code, such as when a vaccine is administered during a routine health examination. Status versus history. A status code indicates that a condition or circumstance still exists and may affect the patient's care. For example, a patient with a heart transplant or a mechanical device has a current medical status that influences treatment decisions. A history code, on the other hand, indicates that the patient had a condition in the past, but it no longer exists. This distinction between status and history codes is frequently tested on certification exams. Common status codes. Examples of status codes include Z94, which indicates transplant status, Z95 through Z97, which indicate the presence of implants and medical devices, Z99, which identifies dependence on machines such as ventilators, Z21, which represents asymptomatic HIV infection status, and Z79, which indicates long-term drug therapy. These codes provide important information that may influence treatment decisions. Status code restriction. Status codes should not be assigned when the diagnosis code already includes the same information. For example, Z94.1, heart transplant status, should not be reported with T86.2, complications of heart transplant, because the complication code already implies the transplant status. This rule prevents unnecessary duplication of information. Long-term drug therapy. Category Z79 identifies patients receiving long-term medication therapy. This includes medications taken continuously to treat chronic conditions or to prevent complications. Examples include long-term anticoagulant therapy or long-term insulin use. These codes should not be assigned for short-term medication use, such as a brief course of antibiotics. Personal and family history. Personal history codes indicate that a patient previously had a medical condition that has resolved. Family history codes indicate that a patient's family members had a specific disease, placing the patient at increased risk. These codes often help explain why screening tests or follow-up examinations are being performed. History coding rule. When history codes are used, the reason for the encounter is coded first. The history code is assigned as a secondary diagnosis. If the condition recurs or becomes active again, the current diagnosis code should be assigned instead of a history code. Screening Z codes. Screening refers to testing asymptomatic individuals to detect disease at an early stage. For example, screening colonoscopies or screening mammograms. If symptoms are present, the encounter is diagnostic testing, not screening. Screening sequencing. A screening Z code may be used as the principal diagnosis when the encounter is specifically for screening. If a condition is discovered during screening, the diagnosis code for that condition is added as an additional code. Observation Z codes. Observation codes are used when a patient is being observed for a suspected condition that is ultimately ruled out. These codes are typically used as the principal diagnosis. They are used only when no signs or symptoms are present. Observation restrictions. Observation codes should not be assigned if symptoms are present or if the suspected condition is confirmed. For newborn encounters, a code from category Z05 is sequenced after Z38, which identifies live-born infants. Aftercare codes. Aftercare codes are used when active treatment has been completed, but the patient requires continued care during the healing or recovery phase. However, aftercare codes should not be used for injuries. For injuries, coders must assign the injury code with the 7th character D, indicating subsequent encounter. Follow-up codes. Follow-up codes are used when a condition has been fully treated and no longer exists, but the patient returns for continued monitoring. The follow-up code is sequenced first, followed by the appropriate history code. If the condition recurs, the current diagnosis code replaces the follow-up code. Counseling Z codes. Counseling codes are used when patients receive guidance or education related to health issues. Examples include genetic counseling, mental health counseling, and immunization safety counseling. The sequencing of these codes depends on whether counseling is the primary reason for the encounter. Donor codes. Category Z52 identifies encounters involving living organ or tissue donors. These codes apply to individuals donating organs, blood, or tissue. They are not used for cadaveric donors. Obstetric Z codes. Z codes related to pregnancy are used when no complications are present. For example, Z34 identifies supervision of a normal pregnancy, which must always be sequenced first. Z3A codes indicate weeks of gestation. Z37 codes, identifying the outcome of delivery, are always secondary. Routine exam codes. Routine exam codes describe encounters such as general health checkups or administrative examinations. If abnormal findings are discovered during the exam, additional diagnosis codes must be assigned to identify those findings. Principal-only Z codes. Some Z codes may only be used as the principal diagnosis. Examples include codes for general examinations, administrative examinations, pregnancy supervision, and certain treatment encounters. This rule is a high-yield CPC exam concept. SDOH overview. Social determinants of health describe non-medical factors that influence a patient's health. These include economic conditions, housing instability, education level, employment, and social environment. These factors may significantly impact patient outcomes. SDOH documentation. SDOH codes may be assigned based on documentation from clinicians other than the physician, including social workers, nurses, and case managers. Patient-reported information may also be used when it is documented and signed off in the medical record. These codes are primarily located in categories Z55 through Z65. Common CPC exam errors. Common exam mistakes include confusing status codes with history codes, using screening codes when symptoms are present, assigning aftercare Z codes for injuries, forgetting which Z codes are principal only, and overusing nonspecific Z codes when more specific codes are available. Exam recall summary. Remember the key principles. Z codes explain why the patient is receiving care. They may be principal or secondary diagnoses. Status codes indicate current conditions, while history codes represent resolved conditions. Screening is performed for asymptomatic patients, while diagnostic testing is performed when symptoms exist. Aftercare codes and follow-up codes describe different phases of care. Lesson summary. In this lesson, we studied the purpose and application of Z codes, rules for contact, exposure, and immunization coding, the distinction between status and history codes, coding for screening, observation, aftercare, and follow-up encounters, the use of Z codes for counseling, donors, pregnancy care, and routine examinations. And finally, the role of social determinants of health in medical coding.